Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Tuesday, February 16th, giving you the update from Albany Med. All right, Fred, let's pop open the first graph here. This is the Capital Region. The graph continues to move in the right direction. These are admissions to the hospital with COVID. We're at 241, that peaked at 553.
Pretty steep decline happening now. It's good.
For sure. Next graph here is admissions and discharges to the medical center. Noteworthy because if you look over the last couple days, single digit for admissions. So not 10 or 15 admissions a day, but sometimes as few as 4 or 5.
And Dennis, the positivity rate in the capital region is below 2% yesterday and trending down on that 7-day average. Goes along with this.
That's very encouraging. And point of fact, Fred, I was looking at some statistics today. In the last week alone, we had 31 admissions in and 59 out. So that came down by 28 right there. So the next graph here is the morning census here at the medical center. You can see here we have 71. Of those, 14 are in an ICU setting and 7 are on ventilators. Now that 71 is interesting for a reason, as you can see on the graph.
So the green line, Dennis, is the peak that we had back in the spring, which was 85, and we're now below the spring peak.
Below the spring peak. That's great news here. Fred, just to give us some perspective, here's some more data. I was looking at this today. Since the beginning, about a year ago now, 932 admissions with COVID. Flu, we've had 1. Now, last year, we had 386 admissions for flu during the flu season. And at this time last year, we had 214. So that just puts it in perspective. The difference between the number of admissions we've had for COVID and the admissions we've had for flu. Fred, there was an article today in the Times-Union, and it was talking about our cancer floor D4 East.
That's right, Dennis.
And we thought it was important just to kind of go on the record and talk about that a little bit today. The article would suggest that the Department of Health had come in and was essentially running operations on our cancer floor. That, in point of fact, is not true at all.
That's right, Dennis. That's not true.
Yeah. We have been aware of the fact that there have been both staff and patients who've tested positive for COVID during the pandemic. Fred, it is unfortunate but not unusual that there are times when you have staff or patients who test positive during a situation like this.
That's right, Dennis.
Yeah.
Absolutely true.
And our Department of Epidemiology has been working very carefully with the Department of Health. And in fact, the recommendations that our epidemiology department made are the ones that the state agreed to.
That's right. Then had already been implemented by the time they talked with the state.
Fred, do you think that we have safe practices here at the medical center?
Dennis, we absolutely do. We have very safe protocols in terms of how we test, PPE use, etc. It's very important for staff to follow those protocols, though.
Okay, very good. So we take this very seriously, of course. We take the care of all our patients seriously, especially the cancer patients, and we just thought we'd just make sure we go on the record and say that, you know, at this time, of course, we're responsible for the care that's going on up there, and we'll continue to work on that.
And Dennis, I would say one more thing. The medical center is safe.
Yes, for sure. Okay, very good. Fred, there was an article today, or recently, I think, in the British Medical Journal that you wanted to talk about.
Yes, Dennis. So I'm going to stumble over this. It's the recovery trial was done in Great Britain, and it's using a drug called tocilizumab, which is a monoclonal antibody that attacks the receptor for interleukin.
Okay.
So that's a lot of words, but basically it's an anti-inflammatory that's used in rheumatoid arthritis. And what they did was they identified over 4,000 patients with high markers of inflammation. Half of them received this drug, half didn't.
Okay.
And it actually reduced the 28-day mortality by 14%.
Exciting.
So pretty significant, statistically significant. It's not a drug that we're using at this point here in the United States, but certainly very positive news as another tool against COVID in the most seriously ill.
I think you and I are both impressed by the speed with which things have been able to come to market in the last year. It's pretty remarkable, whether it be vaccines or therapies like the ones you're talking about. So we'll link that article.
Yes, it's in pre-publication, so it's on the web though, and that'll be on the library link.
Any other further word on Johnson & Johnson and when they're going to be able to bring their vaccine to
So we've heard
FDA?
at the end of this month, the FDA will discuss it. I've not seen any actual date picked.
Okay.
Usually it takes the FDA 3 or 4 weeks to reanalyze the data. And so I think that's going on right now.
All right, we keep our fingers crossed because we have 2, obviously, vaccines now. A 3rd would be wonderful.
It would be fantastic.
Very good. Fred, obviously we all know that we took our operating rooms and we had to reduce them, the footprint of them, for a couple weeks to a couple months, and we redeployed that staff to various
right.
parts of the hospital. We're now redeploying that staff, or said another way, we're going to return many of them back to the operating room. At one point, we had taken our ORs down to as few as 8 on this campus.
That's right.
Where are we at that now?
So Dennis, we're at 18
Okay.
as of this week. Later in the week, we'll get to 20 as we pull more staff back into the perioperative area. And on Monday, we'll be at 22 rooms. Now, as you know, Dennis, we have 34 rooms.
Right.
A typical day for us, not during COVID, would be perhaps 30 rooms running. So we're getting back towards that number, but not exactly there.
And what about South Clinical Campus?
So we close South Clinical on the 11th of January. That's going to open next Tuesday, the 23rd. And Dennis, we're going to open up all 8 rooms. My understanding, there are probably 800 cases that could be performed safely there, and 160 have already been scheduled.
Excellent.
So we're going to move very quickly to open up South Clinical and go full tilt.
One of the reasons why we reduced the number of ORs, of course, is we wanted to be sure that we did not cross over an 85% occupancy threshold in the hospital, which we knew was a hard sort of ceiling that the state had set on us.
That's right.
Are we close to 85% right now?
No, Dennis. We're in the low 70s on today's HERDS report, and we've been hovering there for a while now.
And the other thing that we had heard is that a significant part of our workforce was having to quarantine for a while because of COVID testing, et cetera. Since we rolled out the vaccine, the number of our workforce that are actually testing positive is almost 0.
It is. And Dennis, I was looking yesterday at the peak of our employees out for COVID-related issues. It was over 420 in a single day back in mid-January. Yesterday, that was about 35.
That's great news.
Yes.
That's great news. Okay, I think that should do it. Yep, that should do it for today. We'll be back again then, I guess, on Thursday.
On Thursday.
All right, very good. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.